Most of the time when we talk about elective surgery, we mean non-urgent, non-emergent surgery. So surgery that doesn't have to be done to save a life or to help get rid of significant pain. In general surgery, which is what I do, most commonly that's people with hernias. It's not life-threatening, but we deferred or didn't do those cases during the initial outbreak to try to make sure that we had the appropriate supplies for our patients who did have COVID-19. To reopen at Kearney Regional, we've elected to make sure that we're protecting our staff and the patients by everybody wearing a mask. And in the operating room, we're recommending that everybody wear the more secure N95 mask, just so that we can be as safe in case somebody had an exposure they didn't know about prior to coming to Kearney Regional. Our patients are screened ahead of time and they're brought in, and we still treat them like it's a possibility they have the disease. And then anybody that's not emergent who has some kind of problem that we think could be coronavirus, well, then we would get them tested and treated as would be appropriate. Or if it's an emergency, we just proceed like they have the coronavirus. And so patients who have something that needs to be operated on urgently or emergently and they have the coronavirus, then they're done with the appropriate protective equipment in a room that the airflow goes away from everybody, so what's called negative pressure, and then all of the stuff in the room that needs to be thrown away and the patient's cared for safely, and then they're transported to another safe location, and we try to isolate or minimize the exposure of everybody else to those virus particles. We have very good infection practices that we used before we got to this point, and we're continuing those and we're supplementing them. So we're going to do everything we can to protect you throughout your stay. And we do separate the patients physically and the nursing staff that take care of those patients. Every person we bring in the door is another possible person to get infected. So we're having our patients for outpatient surgeries who are not staying in the hospital. They have to bring a driver because you can't have anesthesia and drive home. So they bring their support person with them, and that support person can stay with them the whole time they're in pre-op, and then they stay there. The patient has surgery and comes back to them, and then when they're ready, then the support person and the patient are discharged. We've been involved in the process of helping decide to do surgery again, and the reasons we're doing it is because our patients want to do it, and we want patients to be involved in their care. So we're encouraging all of the providers that work with us to talk to their patients and decide what's right for them. It's really a conversation between you and your doctor that drives surgery, which has always driven surgery, but especially now is something that you and your surgeon have to decide. Is this too much of a burden to continue to bear, or is it better to hold off, be patient, and wait for more